Namaste Andi. I am Nandakishore from GAMAN Health Center, Integrated Wellness and Interventional Rehabilitation Facility. Today I have Hafsa.
Hi, myself Hafsa Fatima, working as a physiotherapist at GAMAN Health Center.
Lakshman.
Namaste sir. Myself Shikram Lakshman Swami, working as a physiotherapist at GAMAN Health Center.
And Sana, our physiotherapy team who are leading and looking after post-COVID rehabilitation, especially people who recovered from COVID, who went home and then they might have developed a few complications, or during their recovery also we have the complications like thrombus, cerebrovascular accidents, collateral infections, but primary one going to be the stroke secondary to COVID complications. In these, our senior physiotherapist Lakshman, who is leading post-COVID rehabilitation unit, is here to discuss about his experiences, the challenges, because a stroke itself seriously affecting individual life and family, and the stroke not only causing mortality but most of the morbidity is because of the cerebrovascular accidents. Their ability to speak, their ability to swallow, their ability to perform a specific activity might go for good in their lifetime. So in those circumstances, who had a very long battle with COVID, who are physically and emotionally exhausted, then they had another hit, kind of cerebrovascular accident in COVID survivors, getting hit by the lightning twice at the same place. In these circumstances, rehabilitation is not as simple as our regular stroke rehabilitation. I would like to know, Lakshman,
Sir.
What was your first challenge? A regular stroke is something which we were used to help people depending on clinical presentations. Here, the fear of COVID is still there.
Yes, sir.
The medication impact is still there, and especially the cardiopulmonary compromise is still there. And then they had this massive hit of losing control of one side of the body. So, as a physiotherapist, when you are doing your assessment, what are your observations and what is your first priority in those cases?
Sir, mostly when I got the cases from the post-COVID cerebrovascular accident, in that cases we have multiple type of strokes, which could be a ischemic or a hemorrhagic or a combination of arteries or any other carotid artery. The first thing, the first major complication was, yes, it's a stroke case, and one side of the body is paralyzed, and they had underwent a tracheostomy. It was a major thing which was in front of mine. The second major thing, I can say the second milestone which I had to reach, it was the compromised cardiovascular endurance. And another thing, in most of the cases, what I had seen is that the tachycardiac thing. I want to mention something on it. In some cases,
and along with tachycardia, you need to look at people who might have developed deep vein thrombosis.
yes, sir.
So, in stroke patients, your objective is to mobilize them early, and DVTs and other complications are not going to allow you to help the patient mobilize early.
Yes, sir.
If you don't mobilize, they might develop second stroke.
Yes, sir.
Because that DVT risk is going up, and if you mobilize early, also in trouble.
Yes.
So, complex scenarios, how you move around.
Sir, in that scenario, in that cases, the major thing was, it was not just this age or this period, this group of people are getting affected. We had seen the person from teenager to older age. The risk factors are between some may had the cardiovascular issues, some had the pulmonary endurance issues, and some had the old history of commodities like blood pressure, increased in heart rate, that is the tachycardiac, and in tachycardiac also there are some cases in which there are some interventions of physiotherapy which were contraindicated. For example, in COVID, the major thing is you have to clear the chest. But when it comes to a stroke patient with a tachycardiac, physio tries to clear his chest with a percussion, then he will end up with the arrhythmias, and it will be a huge problem that he can't able to respond, that he is getting.
Dealing with arrhythmia could be a life-threatening scenario. You have to be extremely cautious, and arrhythmias are quite common. So it is like post-COVID stroke rehabilitation is like walking on the edge of the knife.
That
Carrying-
two-edged knives. One you have to manage with the COVID, other thing you have to manage with the stroke. And another issue was formation of thrombus emboli. In most of the cases in post-COVID, after recovery also, they showed the second attack of COVID. Formation of emboli in the pulmonary, fibrocytes, atelectasis. In these cases, in these sort of patients, when they are attacked with a stroke or they got a stroke, they have most probably gone for intubation with a tracheostomy and then. So when we, in normal COVID cases also, when we give them a sort of exercises, when we give them interventions, at every intervention we will give them a relaxation position so that they will manage that breathlessness. So the higher task here is we can't push their limits because though they are in neuro cases, we can go for extreme, but because of this COVID, we can't able to push their limits. We have to see whether they are going, their saturation is going down. In that case, we can't able to go for a manual testing like 6-minute walk test, treadmill, or a submaximal or maximal test. Only thing we do have the pulse oximeter, and it's the easiest equipment which you can use and educate ourselves and others accordingly, because when they have so much of different comorbidities. In that, I want to talk about deep vein thrombosis. Actually, thrombosis are the one which are formed because of exertion of layers in the blood vessels, which comes and forms an emboli and a clot. From there, it will not able to pass the nutritious blood to the parts of the body. In that cases, if it goes on struck to any other part in the cerebellar artery, it leads to the stroke. That is a ischemic stroke.
Cerebral.
And when it goes to any carotid, it also gives to a ischemic stroke. Other thing is that if it goes to the coronary artery, it's a life-threatening cause which leads to the myocardial infarction. We have to see these major aspects: his heart rate, his BP, his level of GRBS, because we are treating post-COVID with some sort of steroids which leading the increase in the rush of the GRBS. With that also, while giving a blood thinner, we have to see that there should not be a bleeding, which can lead to a problem in
Lakshman,
Sir.
stroke rehabilitation in itself is a challenging task, and this challenge is multiplied when you are dealing with post-COVID
Yes, sir.
scenarios. You have COVID-induced cardiopulmonary compromise, DVTs, fatigue, osteoporosis, muscle loss, gastritis, and malnourished. Sometimes you have people dehydrated. They might have comorbidities. I don't want to make the list of it. In these circumstances, when they are emotionally down, they might won against COVID, but they got hit by cerebrovascular accidents.
Yes, sir.
How you motivate yourself and how you are actually helping these patients to recover?
Sir, actually, I had a good experience while working with the stroke patients in the GAMAN from the last year. When it comes to a post-COVID person with a stroke case, it was a new challenge to me. The things had, in every step, I had an obstacle, which was stopping my interventions to go forward. The thing here had, the physiotherapeutic interventions can be modified. By these simple modifications, I can lead the person to wean out of the oxygen, as well as I can make a simple strengthening exercises and passive RM exercises progressing to active assisted, so that the effective side attain a good power, as well as the active side. By using that active side, I can go for a cardiac endurance training. With this, I got a hope or shine that things can happen well. With these small modifications and small things, I had started clearing one obstacle in my way. Yeah, it was a long run, but things got better in the long run.
What is the motivation or inspiration for you in these things? What is the word or what is the scenario or how you motivate yourself?
Sir, actually the first motivation started to me when I was working in the COVID wards, because in my mind it was a silly thing that a human, no one teaches the simple breathing exercises, because by birth he takes a breath and leaves out. But now the scenario changed because of a small virus entering into the body, that a simple breathing exercises making a lot of change. Likewise, the main motivation to me was a simple things, not a heavy things. A simple intervention can get a change. Everyone does the same breathing exercises, same thoracic expansions. The thing which changed here, or my team had practiced is bringing a small change or small interventional modification which will give a result. It may be a small, but it was a achievement for us and for my team.
Fantastic. In stroke rehabilitation, therapy hall for me is considered as a battlefield. You are in the middle of the battle. You have all limitations, all clinical challenges, emotional exhaustion. In these circumstances, we have to evaluate clinically that what is on, but especially from a rehabilitation perspective as a good physiotherapist. Our objective is to carefully examine and identify the positives we have in the patient, the strengths we have in the patient, and opportunities we have to help him recover so quickly, and engage all those minor things, accumulate them, build your strength, and help the patient to recover. Thank you, Lakshman, for joining today.
Thank you, sir.
God bless you. Keep it up. Hafsa, so nice to have you here. Right? Sana, so nice. It is pleasure. You are wonderful. Keep working. Keep doing. Keep learning and take it forward.
As an intern, but I would like to thank Sir Nandakishore sir for giving me the opportunity to work at this health center, and giving me the main opportunity to treat the post-COVID patients as well, taking it as an opportunity, like taking as a task that patients to treat those patients which I can't speak to them, but coordinating with them and talking to them, treating them and letting them go home is like a big opportunity for a physio. And thanks for sir for giving me that opportunity to work.
Hi, myself Sana Sari. I'm working as a physiotherapist in GAMAN Health Center. I've just joined 1 week before here as a physiotherapist, and I would like to thank Nandakishore sir for this giving me opportunity and joining here as a physiotherapist. And sir has given me opportunity and courage to work as a physiotherapist here and treating a post-COVID patients, and giving me confidence that I can do it, and I am improving myself, and I'm experiencing a different scenarios here, so that I can apply what I have learned and what I have practiced in my internship, so that I can apply here and I can practice and I can experience. And I'm again thanking the Nandakishore sir for giving me this opportunity.
Thank you. Good job.
At last, I would like to thank Dr. Nandakishore sir for giving me an opportunity to work with GAMAN Health Center. Thank you, sir.